Hello, my name is Dr. Juris Ehrenpreis. I'm Chief Andrologist at the clinic of IVF Riga in Latvia, in Riga city. And we are a reference center in andrology in Riga, and we are dealing with the most complicated cases of male infertility. And of course, the most complicated case of male infertility is the full absence of the sperm in the ejaculate, what is called azoospermia. So approximately up to 10% of all infertility cases among men, they actually do not have any sperms in the ejaculate, in semen, and that is called azoospermia. And these are the most difficult cases to diagnose the proper reason for that and to offer the correct treatment. And the reasons for azoospermia, the lack of sperm in ejaculate, can be hormonal problems, can be genetic problems, can be the consequences of the inflammation, infections, can be some problems in the prostate, problems in testicles, problems at the other level of other organs like pituitary gland, in the brain. So in these cases, very thorough investigation is necessary, and it involves the physical examination, the ultrasound of the testicles, of the prostate, sometimes magnetic resonance investigation of the pituitary gland. It involves the genetic investigation, the chromosome, the genes, and different other investigations in each patient there can differ a little bit. And our advantage is that we work in a very tight team with our colleagues, andrologists, urologists, endocrinologists, geneticians. So we come together and discuss all the results of the investigations and suggest another investigations if necessary, because some cases can be really complicated and difficult to understand what is the reason and what is the best way to proceed. There are some cases of azoospermia which can be treated very successfully with medication, with hormonal treatment, where is a problem with the hormonal deficiency. There are cases when there are genetic reasons, and then some surgical treatment is necessary. For example, testicular extraction of the sperms from the testicles, and we are doing that under the microscope, so it's called microsurgical testicular extraction from the testicles. It's a small operation. Sometimes it's not necessary to go into the testicles. Sometimes we can find sperms in what is called the appendix of the testis or epididymis. So there can be different reasons for azoospermia, as I said, at the hormonal level and the genetic level, the consequences of inflammation. So very important is to diagnose what is the cause for that, and then we know precisely if we are able to find sperm in this patient, where we are able to find, where we should look, what procedure should we apply. Should we do the treatment with medicines, with tablets, or we should go for surgical treatment? And nowadays, in our clinic, approximately 50 to 60% of azoospermia patients are treated successfully in terms we are able to get sperms, to retrieve sperms, which we can use either for natural fertilization or to do the in vitro fertilization treatment. So don't be afraid if you have the in semen analysis is showing that full absence of the sperm, calling azoospermia. There are still more than half of the cases, possibilities for you to become a father for a child. So just please contact us, come to the consultation, and we'll do our best to help you for your dreams to come true and get a baby.